Germany has become the fifth European country to officially pass 100,000 coronavirus-related deaths. Public health officials say 351 people have died with the virus in the last 24 hours. Hospitals have warned that few intensive care beds remain available. On Thursday, almost 4,000 were occupied by COVID-19 patients, forcing the transfer of some German patients abroad for treatment. The EU's drugs regulator has given the green light for Pfizer's COVID-19 vaccine to be used in children aged 5 to 11. The European Medicines Agency estimates that the jab is over 90% effective in preventing symptoms in young children. Austria, currently under lockdown due to a spike in cases, has already started vaccinations among this age range. The European Commission has updated its travel advice for member states, including fresh guidelines for the coronavirus pass, which is used for cross-border travel. It recommends the certificate should be valid for 9 months after the first full vaccination. Research suggests vaccine protection wanes after 6 months, and the EMA said an additional 3 months may be needed to ensure national jab campaigns can adjust and citizens are able to access booster shots. Well, let's head to Brussels to speak to Shona Murray for more on this. Shona, good to see you there. So what other proposals is the EU suggesting to try and counter the fourth wave gripping the bloc, and are the 27 member states likely to come on board?
Well, this relates specifically just to travel within the European Union, because there's a feeling that nobody wants to go back to the situation we were in last year, where some member states were closing their borders or that there was only essential travel. So this facilitates it in the way that it extends the COVID pass until at least the end of next summer. And also now people can get their booster shots added onto their COVID cert. The rule essentially is that, as you mentioned there, vaccines start to wane after 6 months. So it gives a person an extra 3 months to get their booster shot. So essentially you get a booster shot within 9 months of your second vaccine or your full vaccination. And this means that you can travel onwards. It'll essentially prevent people from travelling unless they've been fully vaccinated or have a negative PCR test. Now, nothing really changes for the unvaccinated in terms of travel, other than they will likely have to quarantine in places and also continue to have a PCR test, because this really relates to travel. And other restrictions around unvaccinated are for member states themselves. This is an EU-wide plan or proposal just to allow travel within the bloc.
And Shona, vaccination itself, though, is still a huge issue for the EU, isn't it? Because, well, Ursula von der Leyen saying that just a quarter of adults are vaccinated, are still not double jabbed. Could we see more restrictions being put on those that are unvaccinated?
Certainly within the member states. When it comes to these issues, the EU doesn't have competence, so it can't talk about how unvaccinated people are treated. The EU only deals with the single market and the right to freedom of travel. But we have seen, and in Austria initially, the restrictions were placed on the unvaccinated. Now it's on everyone because the vaccination rates are so low there, 65%. Germany, they're mulling it over that it should be unvaccinated people should have very limited access to facilities. And I think, as Ursula von der Leyen was saying, there is huge divergence within the EU around countries' vaccination rates. Ireland, Malta, Denmark, they have around 92-93% of the adult population vaccinated, yet still are under pressure when it comes to ICUs, even though there's a small percentage of those people are in hospitals and in ICUs. But countries like Bulgaria have less than 30%, around 28% of people vaccinated. So in those situations, it's very unlikely that you see a big uptake on booster jabs. So obviously this issue about unvaccinated versus vaccinated will continue apace, given the next few months and given how contagious and infectious the Delta variant is.